Black History Month is here again. This is an important time to reflect on the achievements and positive things accomplished within the Black community and to celebrate those good things. It's also an important time to raise awareness about issues still pending and troubling the community. This year, I wanted to reflect on the representation of Black people's mental health and the impact of this within the community.
Hello everyone, welcome back to Tea Time Talk. This is a section on this channel where we have some tea and take some time to talk about anything and everything. As the title says, this month October is Black History Month in the United Kingdom, and today we are going to be talking about issues that affect the Black community. So the main issue I wanted to talk about within the community is mental health. There seems to be a lack of fair representation within the healthcare system, in particular mental health. So to start from the beginning about why I wanted to talk about this topic, a couple of days ago, on Monday the 10th of October, it was World Mental Health Day, which is a day which raises awareness about mental health issues. A couple of weeks ago, I came across the stories of Samuel, Bardwell and Raphael Gill. If you're not familiar with these stories, I'll quickly summarize what happened. Samuel Bardwell had an anxiety attack whilst he was playing football, and the hospital he was taken to, the doctor that was treating him mistreated him really badly and did not believe that he was in pain and that he had an anxiety attack at all. And it was very obvious that this man was in a lot of pain and needed help. In the case of Raphael Gill, he was a man who was having some seizures, and the medical people who were supposed to be looking after him did not believe him that he was having these seizures, and the man was so distressed and he was being told that he's a liar, and unfortunately for Raphael that ended in his death, which was very saddening. The common theme between these stories and about these Black men is that they were not believed when they were calling out for help and sharing, with people they trusted to look after them, how distressed they were physically and mentally, and it led to them not receiving the proper treatment they needed. And this raised the question, why? Why were they not believed? I looked into the mistreatment of ethnic minorities, and I limited my search to Black people as it's Black History Month. After hearing these stories, I wanted to find out why there seems to be a lack of empathy to the Black community, especially within the healthcare systems. So as I was looking, I came across a paper which shed light on my question. This research article was written by Kelly, Hoffman and others. The paper is called Racial Bias in Pain Assessment and Treatment Recommendations and False Beliefs about Biological Differences Between Blacks and Whites. So, I won't bore you with all the details of the study. I will link it down below in the description box for you guys to read in your own time if you're interested. I will just talk about the findings and what they imply. The Hoffman research looks into the possible biases in pain threshold amongst patients based on race. Their findings suggest that there is a perception amongst the healthcare professionals that Black people don't feel as much pain as white people. Naturally, if this perception is carried into diagnosis, this can lead into different treatment for the same disease. Could this have been the case for the two unfortunate young Black men in which one of them tragically lost his life? I'm sure a lot of you can relate to those stories and even have your own stories and similar experiences, whether it's first-hand experiences or somebody you know who's close to you. If you want to share your stories with me, I'm more than happy to read them. You can leave them down below, or even you message me on Instagram. I'd be happy to have a conversation. I've personally had a close experience. As I've mentioned previously in one of my old videos, my aunt She had leukemia and she passed away in February 2020. Prior to her diagnosis, it took us such a long time for her to actually get diagnosed, because her GP, looking back now, it seemed like they were very dismissive. It was not an easy journey for her. She got diagnosed in 2018, but the symptoms had been there all throughout 2017. I remember she would always complain about pain in the joints and in the leg, particularly the right leg, especially when she was driving, which is something she'd never done before. And usually on long journeys we would have to switch. I would have to drive, or whoever was there would have to switch driving, which was very unlike her. She always complained about being tired, fatigue, and bruising, and the well-known symptoms of somebody with leukemia would have. She went to the GP obviously several times, and would just say to her, you've just been working too much, too hard, that's all, take a break from work. But it's like she never worked any more than she did. She always had the same routine every week, so why would this routine suddenly start making her more tired than usual if it never affected her before? And they gave her anti-inflammatory tablets, and they would give her painkillers, and none of this would work. And it was, looking back now, it's really confusing that she had all these symptoms, and like on this website Leukemia UK, they say that you need to go to the GP as soon as you have more than one of these symptoms, as early diagnosis could save lives, as they say. An early diagnosis could mean the difference in somebody, getting the right treatment early. There's studies that show that there is some disparities in cancer rates between ethnic groups, and this is one of those types of cancers that affects minority groups more than the white sort of group a bit more. Now, the troubling thing about this as well is that it wasn't even the GP that diagnosed her. So normally with blood cancer, a blood test is supposed to be done to show, to get the results to show, to say that yes, you do have blood cancer. But for the whole year, they were just telling her the same thing: rest, take painkillers. It wasn't working, but they kept saying the same thing to her. There was 1 month where she kept calling them 2 to 3 times, and it was this is a clear sign that somebody is in distress, that they really don't feel well. And then I believe she took a couple of days of rest, and at this time, this was in December I believe, just before 2018, she rested a lot. And then the next year she went back to work after resting, but when my mom picked her up that morning, she was actually really pale, and it was obvious at first glance that she was not well. But my mum went because they work in the same area, so my mum drove her to work anyway because she could not drive, because the doctors had said after a couple of days rest she would be okay. As soon as she got to work, she told the other staff members, who are also her friends, that she didn't feel well and she was just going to be sitting down during the shift. She wanted to come into work because she'd been off for a while. And in the morning, before the shift even began, a doctor who's her friend, looked at her and was like, Marcy, you should not be in work right now. You do not look well whatsoever. And she's the one that organised for her to go and get some blood tests done, and for the blood tests to go to the labs straight away. And then before lunchtime hit, the GP had been calling my aunt, and my aunt was wondering why. I think they'd got the results on the system before she did. I think the doctor also, who's a friend, got the results before her, and my aunt was meant to go to the blood test centre to talk about her results. One of the managers, who was her friend, they offered to go with her because I think they had the results beforehand and they didn't want her to be alone when she found out. And then obviously they found out that she had leukemia all along, and now the GP was calling her frantically and wanted to help, but it was like, you know, she'd been coming to you guys for like a whole year asking for help, and you know, all it took was one glance from her friend, who's a, you know, practitioner as well, and she could just tell that something was really, really wrong. And it didn't even take that long for a blood test to be done. Within the same day she had results. So this story left me like with some questions that, like, if my aunt had been a different race, would the GP have given her a blood test sooner? If she had been diagnosed sooner, would it have made a difference? What would have happened to her if her friend hadn't organised for her blood test to be done that day? We need to raise awareness about these issues, starting within our households. Thank you for listening. See you in the next one.
I just wanted to say that these stories about not only black men, but women as well, being mistreated and let down by healthcare systems, whether it be in England, America, or wherever they are in the world, due to false beliefs and racial biases about who we are as people who don't feel as much pain as other races, are really heartbreaking. As black men, women and children, I think we cannot let these assumptions and attitudes define us and how human we are. We cannot fall into the trap of the self-fulfilling prophecy, because none of these beliefs are true. These stereotypes are damaging with their unfair representations of real people who have wives, husbands, children, moms and dads and friends. These are real people's lives, and some of them are dying because of false beliefs. We all feel pain. We all get affected. No one's pain is more important than another person's, whether a man or a woman, and no matter what race you are. It's really sad to see how these beliefs are seriously damaging, especially to our black men. There's no fair representation on their mental health, even though it's just as important as any other person's. Yes, black men are strong, but they are human beings. They are not machines. They cannot just keep going. They feel as well, and they bleed as well. They can be manly and gentle. They can be strong and sensitive too. They can cry and should be allowed to cry without being emasculated. Too many black men suffer in silence, and when they speak out about their suffering, whether it's mental or physical health, they are not believed. They are humans, thinking, feeling and experiencing the world as any other person. They deserve the same empathy as any other human being on this earth. They too need encouragement to go to therapy and get help. As a community, I think it's important for us to have conversations. Let's talk to one another and tell each other it's okay. We don't always have to be so strong if we can't sometimes. Let's tell each other it's okay to feel things and to express them. We are only human.